Hi people. Now we are talking about Drum Island today, and I did want to dress up as Chopper, but I could not pick together an outfit for that. It was quite devastating for my psyche because I love a good theme. I love it. But it couldn't come together. I don't have the hat, and that's really the most important part of free time skip Chopper, and I don't have it. I don't have a red hat, so it is what it is, whatever, it's fine. But yes, today we will be talking about Drum Island and privatized healthcare. Now, once again, as you may have been wondering for the past two parts, why are we connecting these random wholesome arcs to politics, to world politics? Like, what does this have to do with US privatized healthcare? Well, I'll tell you what it has to do with US and Europe and Canada privatized healthcare, or just healthcare in general. Healthcare, specifically in the US, since I, do live in the great state of America, is a subject that greatly affects people's lives, but has been made into a game by capital owners. When we talk about things like the cost of prescription drugs, when we talk about things like health insurance, these are things that people feel very strongly about because it affects their overall quality of life, but is, especially in a country like the US, for some reason, even though we are the most powerful, rich country, is pretty inaccessible to a large swath of the population. So how exactly could this controversial subject apply to a cute One Piece arc with a reindeer? But first, before we get into any of that, subscribe, TikTok, Instagram, Patreon. I say this every single time, okay? Just do it. Just click the button. It's free. All of them, except for Patreon, are free. Just do it. Okay, come on now. But also, before we talk about Drum Island itself, we have to understand privatized healthcare and the healthcare industry in these major parts of the world. So in America, healthcare has been just a major failure all the way around. 70% of Americans feel failed by the healthcare system, which is huge. 70% of the US population. That's crazy. This is even more insane knowing that US spends more money per capita on healthcare than any other comparable nation, yet still falls behind in life expectancy, patient satisfaction, and high cost. Now, how does that make literally any sense? Tell me, how are you spending the most money and yet you're not giving the best care? According to Harris poll, people's biggest issues were how long it takes to get an appointment, limitations of insurance coverage, and subpar preventative care as their main complaints. And because of these major issues that affect people's healthcare coverage, more people are skipping on medical care, or skipping on going to the doctor, skipping on surgical procedures, whatever it may be. They're skipping out on their health because it is just so difficult to get good coverage, good care. Also, there's insurance. There's just so many gaps and barriers between you and a healthy life. Also, a big thing in America is privatized hospitals. The number of public hospitals in America is diminishing fast. The majority of them, as it stands right now, are private. In the past quarter century, the share of all hospital beds at government-owned hospitals has declined by more than 40%. Many of these public hospitals were unprofitable, but didn't close. They were bought by a not-for-profit or for-profit healthcare system. And these privatized hospitals and privatized healthcare in general is reducing the amount of Medicaid patients, which I will say that, from my understanding, getting Medicaid and being eligible for it in the first place is pretty hard. Whenever, universal healthcare or low-cost healthcare should just be accessible to everyone, no matter what. But that's, you know, a whole nother thing. I really think that this, you know, privatized healthcare and healthcare in general should really just be a video on itself, but this is a good opening for it. And because of the amount of Medicaid patients that are being like reduced, researchers interpret this as a decline in access to care in America. As a result, Medicaid patients, now approximately 1 in 4 Americans, are likely worse off due to privatization, due to the disruption in their preferred provider, and potentially because they may have to travel further or wait longer for treatment. These privatized hospitals are deterring what they deem unprofitable patients, which is Medicaid patients. Since Medicaid is very low cost, they are actively pushing them away with privatization and basically saying like, you can't use Medicaid here, you know. The question really stands, you know, after all that we've talked about, especially in America, with the privatized hospitals and how that deters access to care, just privatization in general, the issues that people have with high cost insurance, you know, all these different issues. If public health care could help give a better satisfaction rate and a better quality of life, better access, you know, if it could solve a good portion of these issues, then why would America opt for a private one? Like I said, this deserves a larger video where we could dive into that deep, but this is just the basics, you know. And I think what we're going to talk about in Europe and Canada will also shed a light on why it is that countries like America go for a private one. Now, universal healthcare, you know, when we think about like places that have universal healthcare, I for one think of Europe first. These are like some of the major places that have had socialized medicine for a pretty good amount of time. Now, what is universal healthcare? This is healthcare that is owned by the government. How it works is that every citizen is enrolled in the national healthcare system, and a good portion of medical services, I think it depends on where you live. Depending on where you live, a good portion of medical services are provided for free of charge by doctors who are also employed by the government. Some of these countries that have universal healthcare allow private practices, but of course it is only provided to those who can pay for it. And a lot of these countries also have a history of regulating privatization and these practices very heavily. At least they used to. Now you see there's been an erosion of socialized healthcare over the past few years in these places like Europe and Canada. Countries like Canada in particular have laws to privatization. Things like dental, vision, and long-term care are not covered by the public system. And some regions in Canada in specific have really big barriers to care or just don't receive good care at all. I think these are probably like rural areas that just get really long wait times and just not good access to care. And I think there is a issue in the socialized healthcare. I mean, nothing is perfect, right? But I still think socialized medicine is far better and far more ethical, I guess is the better word, than privatization. But of course, I think people still have complaints of like long wait times with socialized medicine, but it's still a better step than the privatization that we're seeing. And now we're seeing, like I said, in places like Canada, and even we're about to get into places in Europe, they're rolling back socialized medicine, which is only going to make these situations worse. Corporate lobbying in places like France and Canada have also been a really big influence of these places going private. These lobbyists and these politicians, these people that are pushing for the privatization of healthcare have deemed it to be better for optimization and efficiency. And as we see Europe being further influenced more and more each year by the right, I mean, I have even thought about making a video about this, how like Europe right now is kind of being taken over by the right in places like France. You know, Italy literally has a fascist as their prime minister. The Tories in England, you know, Poland, I'm pretty sure has some right-leaning people. Sweden, you know, like it is really being taken over by the right, you know. So as we see that happening, We also see this correlation of healthcare and these really important things that contribute to the quality of life of the people living there. We also see a decline in politicians and these leaders caring about patients and them getting better access to care, and more about optimization for financial gain. So how does all of this apply to Drum Island? Okay, because let's not lose sight. All that we just covered is included in the Drum Island arc. I know that may sound crazy, girl, but it is. Let's just set the scene. When the Straw Hats arrived, King Wapol had completely privatized the healthcare infrastructure on the island. Okay, now the king had like left, I believe he had left the island entirely. That's how the Straw Hats ended up meeting him in the first place, was on the sea, and he had taken his doctors with him, which left Drum Island completely devoid of any doctors except for one, which was Dr. Kureha. These 20 doctors that he took for himself, I think he took them for himself long before he even left, though, were called the Ishi 20. I mean, we see them in flashbacks whenever they're talking about Chopper's mentor. I forget his name, but the old guy that Chopper first found and loved and was like his father. We see in those flashbacks that there's like this beginning of King Wapol starting to privatize this island's healthcare infrastructure, taking these governments for himself and limiting the access of care. I mean, that means that he only gets to choose I think he used them mostly for himself. I don't think those doctors worked for the people at all. And so these people were just left without good care, except for these 2 doctors, and then one of them ends up dying, which is just messed up. And Dr. Kureha, who is the only doctor left, is also herself pretty inaccessible. I mean, she's the only one that is willing to work for the people, but she lives on the top of a freaking mountain in an abandoned castle, like, and she only comes down to serve people, like a small amount of people, and then she goes right back up. So these people are just left without a good amount of care. I mean, she's only one person too, like she can't just serve and serve and serve. So she gives really good care, and she provides like miracles, I'm sure, for these people, but it's also still very inaccessible. So this monarch has just created this crisis within this island that used to be, I believe, the peak of like medical care where are we in the Grand Line? Is that where we are? Used to be the peak of medical care in the Grand Line, is now deprived themselves of medical care and has just, their infrastructure just has been completely eviscerated. And essentially the Straw Hats re-implement socialized medicine on the island. Okay, like when I tell you Luffy is an anarchist, when I tell you he is a leftist, I'm not kidding. Okay, they literally at the end of the arc re-implement socialized medicine. Like, I don't know what to say. I really don't know. They bring down the monarch and then they re-implement socialized medicine. Like, nobody else is doing it like them. Like, for real. So hopefully this has blown your mind and you're like, whoa, this arc was about healthcare and privatized medicine, because it's literally a 1-to-1, bitch. Like, it's literally a 1-to-1. Like, whenever I'm describing to you what happens in Europe, what happens in the US, it's literally a 1-to-1 what's happening on Drum Island. Like I've said time and time again, One Piece is political. Thank you so much for watching. I hope you enjoyed, and I'll see you in the next one. I'm still watching Skypiea, and I'll try and see if I can come up with something for that. I don't know if I can, but so far watching it, I'm only like a few episodes in, but I don't know what it would be about necessarily. So I don't know, we'll see. I don't know, we'll see. But yeah, I'll see you in the next one. Okay, bye.